that one of the important causes of infertility is because of infection, which may be either in both the partners or one of them. So clinics or hospitals, it needs lots of investment.
Yeah.
So from the public sector, I'm not as hopeful about having such a.
Dr. Supong, thank you so much for agreeing to do this with us. It's a company, it's called Subak Health Tech, and we were featured at Shark Tank India. And after that, we decided to go ahead and try to destigmatize infertility as much as possible in India because it is a problem. And perhaps in Nagaland it's not as pronounced as other places, but in other places it is a problem. And therefore we started. I've been trying very hard to talk with a few doctors from the Northeast also so that there's a representative. So thank you for doing that. For our viewers' sake, could you kindly introduce yourself to us?
Miss Dr. Supong. I'm a senior specialist posted in the district hospital, specifically in the district hospital of Mawabchung district in Nagaland state.
Right. Mukukchung being like in the center of Nagaland, right?
Yes.
Yes. So as a practicing gynecologist in Nagaland and as a practicing, let's say, senior gynecologist in Nagaland, you have worked with people across the state. You've been posted in different places. And I've seen you personally being at the site and working very hard. What does infertility look like in our state, Nagaland?
It's like in almost all parts of the world,
Hmm.
and especially these days, the world being becoming a big global village, you can see that infertility has it has gained ground and it's becoming a very major health issue, especially among the married couples, even in Nagaland, just like in any other parts of the world. And we can see that the problem of infertility is increasing in not only just in the urban areas, but even in the rural parts of Nagaland.
Right. And I keep wondering, okay, urban areas, you understand biggest lifestyle problem, um, environment and all, but how come in rural areas also? What seems to be the issue? Because it's not just in Nagaland, see infertility in rural areas, it's all across India.
One thing is, we should know that even though we call it rural area, the lifestyle and food habits, it's almost becoming similar in both the rural as well as the urban areas. But most importantly, we know that one of the important causes of infertility is because of infection, which may be either in both the partners or one of them. So it's due to such causes, I feel like it might be increasing even in the rural areas.
Oh, infection as in sexually transmitted infections.
Yes, specifically yes, but it can be even other genital articulating infections also in the
Yes.
body, which might indirectly directly hamper the process of the capability of being able to get pregnant.
Right. Women seem to bear the brunt of stigma when it comes to infertility, even though everybody says that it's a couple's issue. Do you feel that concept, that thought process applies to Nagaland as well? I'm only asking because Nagaland is, right, because I feel like Nagaland is a much safer place and a more woman-friendly place than a lot of other places.
Yes, in general, we can say that Nagaland is in fact more gender friendly compared to some parts of India, but we can see that when it comes to the issue of fertility, both the male as well as the female partners, they feel the pressure and the anxiety of this problem. But in my experience, I should say that the women they definitely appear to be more concerned, and likewise, we are more proactive in trying to treat this issue. So definitely, we can see that the women they feel the brunt of this issue more.
Great. I was told recently that infertility among male is more in number than among female. It's more easily detectable and it's more easily treatable. Do you agree with that?
Mm, infertility being illness or an issue involving two partners, and as given in any literature, both the partners they share um, maybe even equal or similar reasons for the cause of this. Infertility being an issue where the causes can be either of the male or the female partners, or sometimes it can be a combined reason for the cause of infertility. So, likewise, it's a very sensitive issue, and whether it's proven or not, most of the time the female partner usually gets the blame for the cause of infertility. But especially in a place, what I see is that in most urban areas, especially when the people, our patients are more educated, um, people are more understanding, and they come forward. Even the male partners, they come forward and offering, to go for different investigations themselves. So I feel like education plays a really important role in the understanding and handling of this issue.
Very true.
And moreover, I think the treating doctor or the counselors, they play a very important role in having proper discussion with the couples, and even proper counseling of the partners, starting from from why it happens, how it happens, to guide them towards the different types of investigations and different types of the treatment.
Which leads me to the next question. There seems to be a lack of counselors in India when it comes to dealing with fertility issues. Does that hold true for the state of Nagaland as well? Do we have a lack of counselors, trained counselors?
Unfortunately, very much. We actually don't even have a fertility clinic or hospital in my own posting place, that is Mokshu. The nearest infertility treatment centers are in Kohima, that's the capital of Nagaland, and Dimapur, that is the commercial hub of Nagaland. And besides that, we have to visit the nearest state, Assam, where they have different infertility clinics in different towns and cities. But unfortunately, in our own hometown, Mokchung, we don't have any such clinics, so we don't have any contacts or any counselors to discuss these things with those affected partners.
And yet the problem of and yet the fertility issue is rapidly evolving, and it's affecting all parts of Nagaland as well. I wish Mukokchung being centrally located, I wish Mukokchung had a fertility center, because from Mukokchung, they can access the interior parts of Nagaland. So geographically, that makes a lot of sense.
Yes, geographically and even population-wise, it makes sense. But the thing is, infertility clinics or hospitals, it needs lots of investment. So from the public sector, I'm not as hopeful about having such a setup from the public sector, but maybe private setups in the future, maybe, hopefully, we might be able to see some, which will be definitely helpful for not only our own Mokshu people, citizens, but even the citizens from the other adjoining districts.
Right, exactly. Let's just hope that it happens soon, because Right now, what is happening is if somebody from, let's say, Mokokchung and the other interior parts of Nagaland want to get treatment for fertility issues, they travel to Dimapur, which is the commercial hub, or they travel to Kohima, which is the capital. Otherwise, they go to Assam for treatment, which is just unthinkable in so many ways.
Yeah, that's the current scenario.
Oh, no. Well, that is really hard to take. But the one good thing about Nagaland and people that I've seen is, as a society, we are more accepting of a lot of things. Do you feel like infertility issue is the acceptance or the resistance to fertility issues in a couple? Do you think it comes down to individuals, families, or as a society, are we resistant?
Actually, from my experience,
Hmm.
it ultimately boils down to the understanding of the particular family
Hmm.
or even those individuals, because as such, since infertility itself is a very new topic, very new issue, just
Right.
like HIV was in the beginning. So there are many stigmas associated with it. So it's not that serious like it was during those HIV days, or there's some misconception about it. But with proper discussion and with proper counseling, um, people are realizing
Yeah.
the need for proper investigation testing and especially the involvement of both the partners in
Yes.
dealing with infertility. So I should say, as of now, uh, though the society, our society, it's not that I should say resistant about it, but ultimately it boils down to the individuals or the family concern.
Mm-hmm. And from the family starts the stigma more, and it hurts more. So,
Depends, yes.
right. According to you, then, doctor, what is the most common cause of infertility for both men and women?
Mm, Actually, these days, as we see with the uh, changing in the demographic what they call situation
Mm.
and about lifestyles, so I should say age is becoming playing a very important role in the recent this infertility. Like both the couples getting married late after you know
Mm.
uh, getting established in their own career
Yes.
or maybe um, professionally achieving something. So
Yes.
I feel that's becoming a very important factor all over the world and including here also. And
Mm.
besides that, there are some factors like how should I say
Lifestyle.
infections. Infections
Mm.
definitely very important role. Different types of infections.
Mm.
Another thing which I've noticed is that um, in some couples, in some
Mm.
part of the population, there are people like where the couples, they lead very um, active professional or private lives such that sometimes quality time cannot be given to each other, which itself it's a very important factor that leads to infertility.
I would say that's the most important factor.
Like, yeah, like both the wife and the husband being posted professionally in different
Yes.
parts of Nagaland. Maybe someone posted outside Nagaland. So sometimes such issues I've also come across in my life.
Right.
Uh,
And especially for the woman, getting the chance to get pregnant only once in a month, timing is so important. And if during the timing they have to go for a meeting or go on tour, then that's it for the month.
yes, that's what I've noticed. Yes.
So that's a rising concern in Nagaland also.
Yes, exactly.
Oh,
So we may not be, very fast-paced life like in the cities and the metros, but definitely our population, especially the younger generations, they are all um, engaged in different social responsibilities and as young professionals. So everyone, including the women, most of them are always on the move. So that also becomes one of the issue. And similarly, that's also one of the reasons why uh, late age marriages are in the increase these days, and that's one of the very most important factor
right.
in our case.
So getting married very late in life, which decreases the chances of getting pregnant. Infections also play a very vital role, which is not just sexually transmitted infections, but other forms of diseases and infections. And we have a timing issue